If you'd introduce yourself.
Ken Pearce, and I'm the Health Commissioner for the Lorain County General Health District.
Ken, there's a lot of talk going on about the flu this year. If you could give us some facts and some myths about the flu.
Well, of course, H1N1 influenza is what we're experiencing quite a bit of right now in the United States. In fact, almost exclusively. Seasonal influenza will not occur probably till December, January, February. But that's what we're experiencing. Of course, one of the myths have been out there is that, of course, H1N1 has not been studied as effectively as, say, normal seasonal influenza. That's not really true because the FDA has conducted all the studies they would normally conduct on seasonal influenza, only they've done that on H1N1 and including even more studies. So it's produced in the same manner that has been used over the last 50, 60 years to produce any vaccine, including the vaccine for seasonal influenza.
Okay. What are some of the things, I know you do a lot of work on the internet to see what people are saying. What are some of the things you're hearing on the internet that you would like to clear up?
Well, some people are very concerned that this new vaccine is going to potentially cause influenza. That's not true. It's a killed vaccine, just like the seasonal influenza vaccine is a killed virus. This is a killed virus as well, and therefore it's not going to cause disease. It stimulates the body to recognize the virus should they become exposed to it, and then it'll help them fight off the virus. So that's what vaccines do. And of course, this particular H1N1 vaccine probably would have been included in the seasonal vaccine. Like currently there are 3 different viruses in the seasonal vaccine, but because of the nature of the outbreak and the manufacturing process, the timing didn't occur to be able to include it within that vaccine. So therefore we have 2 vaccines available. Now, naturally, that complicates some issues because people see there's a difference. There really isn't any difference in the vaccine other than it's a different virus. Every year there are different viruses chosen to be in the seasonal vaccine. So this really doesn't change anything as far as the vaccine production, the vaccine safety, or in terms it does protect for a different style of virus though.
And then one of the things that's different with this virus is who it targets. And how is that affected? That's
correct. Early, when they were looking at the early outbreak of the H1N1 or swine flu, it was called at that time, they noticed that most of the people more seriously affected were younger people, pregnant women, and those younger individuals that had chronic diseases, as opposed to seasonal virus, which is typically older people over 50 and those with chronic diseases such as heart disease, lung disease, maybe diabetes, kidney disease, and of course any other chronic condition that could actually put them at risk of more serious health problems if they actually got the virus.
And then the virus, we went through before, it didn't seem like it was that widespread. There weren't that many people taken down by it. How is it different now? Why is there seem to be more concern about it?
It's sort of built up speed over time. Right now there have been identified worldwide 41,000 cases. And it's expected that there will be more and more cases. And in fact, in the United States right now, currently in early October, we're seeing widespread influenza activity, and virtually all of that influenza activity is related to H1N1. So the virus is starting to how we generally say amplify within the population. So it's starting to build within the population. As you have more people infected, they are more likely to infect other people. So that's how the virus starts to spread.
And then, the importance of the vaccines in particular age groups then, how does that work out?
Well, certainly with the seasonal influenza, that hasn't changed. We're looking for individuals over 50 that have that because of their age, and then of course those that would have chronic diseases such as heart disease, lung diseases, diabetes, kidney disease, those sorts of issues that could cause a problem. With H1N1, it's affecting younger people, younger children, those under 24, and of course pregnant women, more disproportionately higher than older people. So we're targeting the younger population first. and the medical providers and those that would be taking care of babies and young children. We're targeting them so we can actually prevent the spread or the amplification that I talked about earlier.
Okay, so if people in Lorain County want more information on this, where can they go to find out information about the illness and flu shots?
An excellent source to find out general information about H1N1 or seasonal flu is flu.gov, www.flu.gov. It's an excellent source. In fact, we link that from our website, loraincountyhealth.com.